Good morning everyone. Here we have a patient all set for hair transplantation. He is in his early 20s and as we see the age for a receding hairline is getting delayed, as in the age is becoming younger. More and more young patients are coming to us with receding hairline, severe hair fall, some hair fall which is continuing for years. So in his case, his hair fall was around 2 years long, right? And he has a complaint of hair loss in the frontal area as well as in the crown area. If you look down, we can show there's a hair loss in the front as well as the crown area, the vertex. He happens to be a typical case of male pattern baldness, androgenic alopecia. He also has a family history. We have marked the hairline and the temporal triangles for him. We will be implanting about 3000 odd hair only for the frontal area today. Also, he has, we have told him about the FUE technique, which is follicular unit extraction. We'll start with patient preparation first, where we'll be trimming the hair. The hair is trimmed such that it's easier for us to extract the follicles, which will be from the donor area, the back area, the occipital area, and the implantations will be in the frontal region. Patient preparation involves trimming the hair such that it's easier for us to extract because it will be single unit extraction, follicular unit extraction. Also, this is done under local anesthesia. The procedure is not painful because the anesthesia procedure, the anesthetic part is where the patient feels the prick. The only thing is, yes, it takes time because you have to continuously change the head positions of the patient. We've informed him about the aftercare also, and we'll also show you as to how the extraction and implantation process is done. Thank you.